It is the top of the hour, and I think we will get ourselves started. So let me welcome everybody today for our webinar, Using the Core Competencies for Public Health Professionals to Support Workforce Development. I'm Ron Bialik, President and CEO of the Public Health Foundation, and we're delighted to have you here today and that you've chosen to join us. Before we get started, let me turn this over for a few housekeeping items from Mayela Arana.
Thanks so much, Ron. Thank you everyone for joining us today. All participants have been muted upon entry into today's webinar. You will have the opportunity to ask questions during the Q&A sessions. Please go ahead and put your questions into the chat box throughout the webinar. You may also use your raise hand feature if you have any technical issues that require assistance. So please go ahead and use the raise hand feature and chat me, PHF Webinars, in the chat box, and we will do our best to assist you. This meeting is being recorded and will be shared via the PHF website and the Train Learning Network. Turn it back to you, Ron.
Thank you so much, Mayela. Well, for today's webinar, we'll spend a few minutes discussing the core competencies for public health professionals, which is the foundation of today's webinar. We'll then hear from our colleagues in both the Missouri Department of Health and Senior Services and the City of Milwaukee Health Department. They will talk with us about their approaches to prioritizing the competencies for workforce development within their agencies. Following the presentations, we'll have time for Q&A, and feel free to put your questions and your comments in the chat box throughout the presentations. And lastly, we'll be sharing with you some resources that may be useful for your work on public health infrastructure. For those of you who may be unfamiliar with the Public Health Foundation, we're a national nonprofit organization, and we've been in existence for more than 50 years. We strive to achieve equitable and optimal health and well-being for all. And in carrying out our mission to advance the public health workforce to achieve organizational excellence, we do a great deal of work with state, tribal, local, and territorial health departments. We also staff the Council on Linkages between academia and public health practice, which is the body responsible for developing and keeping the core competencies up to date. The Council on Linkages is a consensus developing body comprised of 24 national public health practice and academic organizations. One of the Council on Linkages' major activities is the core competencies. The core competencies articulate the knowledge and skills desirable for the broad practice of public health. The core competencies have been around for more than 20 years, since 2001, and they've gone through several iterations. The current version being adopted by the Council on Linkages in October 2021. This version of the core competencies has 8 domains addressing data, policy, communications, health equity, community partnerships, public health sciences, management of finance, and leadership and systems thinking. Under these 8 domains, you'll find 56 core competency statements. These competencies are used in workforce development activities throughout our country. To assist health departments in using the core competencies, Public Health Foundation offers a variety of consulting services. These consulting services focus on workforce development, as well as quality improvement and performance management. Through our consulting services and as a technical assistance provider under the Public Health Infrastructure Grant Program, we were fortunate to be able to work hand in hand with Missouri and Milwaukee as they embarked on their core competencies prioritization efforts. We'll now be hearing from key players who led their agency's efforts in prioritizing the core competencies. We'll start with Brenna Davidson, who's the Operational Excellence Leader and Chief of the Office of Performance Management for Missouri's Department of Health and Senior Services. Brenna leads the agency's Lean Six Sigma strategic planning and information technology advisory committee teams while working to maintain Missouri's FAB accredited status. Brenna has a passion for continuous improvement and change management. which she uses to collaborate with team members across the agency to develop innovative initiatives and improve workforce culture. Following Brenna's presentation, we'll have two presenters from Milwaukee. Kiki Lezama is the Director of Public Health Workforce Infrastructure at the City of Milwaukee Health Department, working on building the public health workforce of the future focused on equity and racial justice. Kiki is passionate about systems change, focused on dismantling systems that perpetuate health and racial inequities. She is dedicated to elevating voices of community and creating inclusive environments for all. Further supporting this passion, Kiki began her doctorate studies in 2022 in the doctorate program of public health program focused on leadership, advocacy, and equity at Tulane University. And finally, we'll hear from Lindsey O'Connor, who's the HR administrator for the City of Milwaukee Health Department. Lindsey has 22. She has 22 years of HR experience in a variety of industries and has worked in public health for the past 2 years. Through her work, Lindsey has written organizational policies from a racial equity lens and changed the organizational culture from a punitive one to understanding and inclusion, meeting people where they are. Now let me turn this over to the people who you really want to hear from. Brenna.
Good morning. In Missouri, it's morning, so good morning, folks. It's exciting to see a lot of folks in Missouri here in attendance, and some folks that I met just last week in San Diego at the FIG reverse site visit. So thank you all for being here today. Thank you, Ron, for the introduction. So I'm going to talk a little bit about how Missouri went about our workforce development planning. So Nolan, if you go to the next slide, I'm going to talk a little bit about that approach to the project. So we realized on our reaccreditation journey that we were going to need to meet those Domain 8 requirements. And we had such a great working with ASTO on our strategic planning one that I said, hey, I'm going to reach out and see what help is available. And they were like, hey, you know, we can help you, but the Public Health Foundation is really, they're the experts. So we connected to the foundation through the FIG TA, through the 5 systems. So thank you to the CDC for supporting that connection. And we started on a project to adopt those linkages on the Council linkages core competencies that Ron was explaining. So we decided to organize our workforce around that framework. So starting off, I just want to give you, I'm going to cover how we went about it, but some job categories, because in the state of Missouri, we are not considered a super agency, but we do have divisions that do non-traditional public health. So we have regulation and licensure, we have cannabis regulation, senior disability services. So from the beginning, our leadership really took the approach of, hey, we want this to be a plan that is inclusive of the entire department. And even though we may say public health a lot of folks don't see themselves in public health. So we created these 6 job categories to encompass just about everybody in the department. We have about 1,900 FTEs. So business operations and support, that's where I land as an operational excellence person. This is like our support staff, our frontline folks, our accountants and things like that behind the scenes. Safety and preparedness, we are big about including health and safety in our vision and our mission, because that is more of an inclusive statement for those folks that don't think they do public health work. So this is our regulation folks, our lab folks, cannabis regulation, those people in the department. Public health services is it's pretty self-explanatory. Our public health professionals fall into that category. Data services would be the folks that do serious data analysis and visualization for both public health and regulatory entities. Customer support and human services, we, especially in those non-public health divisions, we have a lot of folks that have contact with citizens. So these are our senior service specialists, our adult abuse neglect hotline folks, anybody who has that touch point with the public. And then lastly, we did directors. So that category includes department directors and deputies, division directors and deputies. And I think that was the end of that category. We wanted that to be a pretty smaller slice of the pie because we wanted representation from the other categories. So on the next slide, I'm going to cover a little bit about the process. And that started through phases. So this is actually part of the communication that we put together for the entire department. So they understood and felt clued in about what we were doing. So Phase one was creating those categories. We did that with leadership and as an internal planning team. And then we defined them in short little statements like business operations support includes individuals who do blankety blank. That way folks could figure out exactly where they fell. And then phase two, we did interactive workshops that identified priority competencies. So this is where the foundation came in clutch for us. So we had virtual workshops where we had, I think, up to 30, maybe 25 to 30 representatives from each job category. They connected, learned about the core competencies, and then identified which ones, after speaking amongst themselves, that they thought were top priorities for their categories. So if I'm a data services person, critical thinking is going to be up there, evidence-based decision-making is going to be up there, using data and collecting and analyzing, obviously very important too. We took those priority lists and then we did in phase three an all staff survey. So we did through Qualtrics and through the Public Health Foundation's like administration, we submitted to everyone. Part of this was also communicating out to everybody so they felt they understood what was going on. But they had the chance to say, okay, I am Brenna and I'm business operations and support. Even if they weren't in those priority workshops, they got to see what the definitions were for the categories, what the core competencies are, and then they will able to actually rate their proficiency for each of those prioritized competencies. So started with, these are the ones that are important to us, and this is how people think how proficient they are around it. We kind of avoided using the word competency again because it was a little confusing with the core competencies versus what am I rating here. So we called it proficiency, same thing. And then at the end of that survey, they were able to say, hey, I really wish that we had more in-person training, or I like hybrid trainings or on-demand trainings. So we kind of sold it about this is your chance to weigh in on our plan. And then phase four, off the screen on the final product, we worked with Amanda Picardi from the foundation to actually write the plan. So we analyzed those results, we got the findings, and then we built that into the training plan. So on the next slide, I want to show you a little bit about how we went about communicating these things, because this is so important for people in the department to feel clued in about what's going on. In the state of Missouri, we have 6 divisions and a director's office. I am housed within the director's office, and we always want to make sure that divisions are feeling included and that it doesn't seem like the folks in the ivory tower physically up the hill behind me are the other buildings are writing plans about people without them involved. So we did a big communication push here, and on the left side here under the promoting the survey, you can see how I kind of framed it. We created an intranet site that had, okay, here's why we're doing this, and here's the approach to it. A link to those job categories and descriptions, a link to the all staff survey while it was open, and then there were personal contacts within myself and our leadership and development team lead that they could actually call up and say, like, what is this? What am I doing here? And then you can see that I said, share your perspective to help us create a training plan that works for you. So that was kind of the hook of, this is your chance to tell us how you want training to be for the next 5 years. And then for ongoing communication, we have department-wide monthly town halls that are available to all team members. We usually get 600 to 700 live attendees, and then we upload those to YouTube afterwards and get a couple hundred more watching the recording. So I spoke about the survey and the project approach on that monthly town hall when it was live. And then our team is going to cover the actual final plan that is available now to team members, I think next month on the town hall. So that one was a big one. And then health planning training for senior leaders. We actually got our department and division deputies and directors together into a room, and we walked through each one of our big health plans and how we did it and why it's important. And then I speak about this at every month at new team member orientation alongside our strategic plan and explaining our vision and mission, some big concepts of like, welcome to the department, here's what we're doing and what we're working on. So on the next slide, I've got just some like quick overview of our whole plan. It is available on the PHF website, and I'm going to drop that link in the chat to everybody because I'm very proud of it. Please check out the plan. So they ended up having 3 main priorities. So the first one, strengthen the workforce through empowerment, education, and development. That's all about retention and leadership development and the training plan itself. Second, ensure a competent public health workforce. So you hear competent, you know it's going to be linked to the core competencies. And then we're also going to be doing a training on FPHS and health equity for everyone in the department. And then the last one, position DHSS, Department of Health and Senior Services, as a destination employer. So that is that sense of belonging, recruitment strategies, and onboarding experiences. Because we want our agency to be the one that when folks go to the state of Missouri job opening site, they say, ooh, I'm going to filter by that agency. I want to look at those openings. Our plan is a 5-year plan, and it is developed as a part of our FAB reaccreditation cycle. We are nearing the end of our 45-day window for the initial review. So we're very excited to turn in. We only had 8 measures reopened out of 126. So I'm very proud. But we will continue this one. This is one of our annual reporting categories, and it is connected to an entire category within our strategic plan, and gives that a strategic approach to things. We also have it published for you guys, but I wanted to plug that we undertook this health planning project department-wide, and we didn't really connect it to accreditation or reaccreditation for our team members. We wanted them to understand we're doing this because we need to do this, is the right way to do your work, and accreditation is a byproduct of that. So that's just a little bit of how we've internally communicated it, but we're also externally very proud of ourselves when it comes to reaccreditation. So my last slide, I just wanted to do a big thank you to the foundation. So you can see Sonia Armbruster and Amanda McCarty are pictured here. Sonia did that expert facilitation of those workshops. So she was the one that was able to explain every core competency, the reason behind it, the real meaning, and then coordinated all those folks in those categories, prioritizing. And then she also, yes, love to hear that, Christina. Yes, Sonia's amazing. She also collected the results for us in a really easy to understand way. So we took that onus of the analysis off of our team. And then Amanda was really behind the scenes with us, helping us like, okay, here's an outline for the plan. Here's what you should include here. Have you done this assessment? Do you have PH wins plugged in? So she was our guidance on like creating that final product. So thank you so much for the opportunity to share our approach and the partnership from the foundation. I encourage everyone to reach out to them either directly or through 5 requests to get connected, because they really are thought leaders in this world. So thank you all.
Thank you so much, Brenna. And there'll be, again, opportunity for Q&A after all of the presentations. And feel free to put your questions and comments in the chat box. And let me now turn this over to both Kiki and Lindsey to share their insights on using the core competencies in a prioritization effort. And they also did something a little bit different. They integrated in racial justice competencies into their effort in the City of Milwaukee Health Department. So let me turn it over to Lindsey and Kiki.
Good morning, good afternoon, wherever you guys are calling in from. Thanks for joining us today. I'm Lindsey O'Connor. My pronouns are she and her. Kiki and I have been working closely on this project, and we were lucky enough to receive funding through the CDC, through the FIG grant, and out of that is the work that we're doing on our workforce development plan. Workforce, as you'll see here, is the name that we've coined for this. I say we, but Kiki is really the creative mind behind this. So we're looking at public health, occupational readiness centered in equity, and the City of Milwaukee Health Department is committed to becoming an anti-racist organization. Next slide, please. So why are we here? So from the FIG grant, we're wanting to move into Public Health 3.0 framework, which we're not in just yet. So we really want to focus on our community partnerships and building a diverse workforce that looks like the community that we serve. We're close, but we're not there yet. Innovating paths to community engagement. So trying to get individuals that we serve participating in the work that we're doing, and then actively promoting sustainability through the efforts. And the most important at the core of these efforts is our desire to become an anti-racist organization. Next slide, please. This is our timeline. In 2019, the Commissioner of Health declared racism as a public health crisis. We were one of the first departments in the nation to do so. at that time, the strategies had not yet been identified. We had several changes in leadership, and in 2021, 2022, we received more stability from our former commissioner, Kirsten Johnson, and our current commissioner, Mike Todoritis. In 2022, we implemented our strategic plan, and a part of that core is anti-racist strategies. So we're focusing on making sure that we create authentic ways in which we can dismantle racism in our policies and our programs. So as Ron mentioned, in my role with the health department, I started in 2022. So I've had the opportunity to actually implement a racial equity lens into writing our policies and procedures, which has been really meaningful for me. I haven't been able to do that in other roles. And we're also using frameworks rooted in racial justice. We wrote an anti-racism policy and implemented it in 2023. And we also in 2022 created our racial equity initiative, which Kiki and I would be happy to talk about with anybody, where we worked with an outside consultant to actually train our employees on anti-racism strategies and how to become what we call equity champions within the department. And then in 2023, we hired Kiki, which was great, so that we could get our workforce planning going. And we knew that we wanted to implement the core competencies, working with the Public Health Foundation. And so we started that process in 2023. And again, we're really trying to foster a diverse, representative, and anti-racist workforce. And with the 5 requests that was sent in, we were paired with Public Health Foundation in order to do that. And I'll pass the next slide over to my partner, Kiki.
Thanks, Lindsey. I apologize today, everyone. I have to remain off camera, but I'm here present, very excited that you all are here. So as Lindsey mentioned, in 2023, we paired with PHF and started our core competency prioritization process. And in that process, we developed 6 job categories, which, you know, comparing it to Brenna's, right, it looks a little bit different, but I think that really highlights and serves as testament as how you can customize job categories to fit your organization while still using that standardized right language of the core competencies. So I love always seeing how different health departments use those in conjunction and alignment with their workforce. So in this process, we had core competency prioritization meetings for each of these job categories. And when we were going through, each of these sections had, each of these categories had their own prioritization meeting. And so naturally, they went through and they used all the 8 core competency domains and said, which ones do you need absolutely to do your job? We have to prioritize these. But then we thought, well, wait a minute. Are there just 8 core competency domains? That's what's included, right, in the main core ones. But we said, but is there another? Should we be using another? Next slide, please. Because the Public Health Training Center has racial justice competencies. And as we are moving towards becoming an anti-racist organization, we said, well, should we consider these in this process? Next slide, please. So then came down to this debate that we all had where we were kind of in uncharted territory of asking ourselves, well, are there just 8 or is there really 9 domains? And the core competencies, part of this discussion included the fact that, you know, domain 4 is a health equity domain, right? And we said, well, is this explicit enough? Does this give does this convey what we're wanting it to convey as far as training and developing our workforce to be this anti-racist workforce? Next slide, please. And then we went to basically the core idea of Ibram Kendi's idea of being anti-racist. And this is just a great quote. If anybody has ever read How to Be an Anti-Racist,
There's a really cool conversation starter deck that you can use from him too. But he says it's simply not enough to sit quietly and be not racist. Now's the time to be anti-racist. So it's this different narrative that we really wanted to capture in how we're training and developing our anti-racist workforce, in that we wanted to be very, very explicit about what we're doing to dismantle racism in the public health workforce. Next slide. So, right, we in our reflections in having these conversations, we said, well, if we don't ask those really hard questions and be explicit, we kind of remain in the fear zone here. I don't know if anyone's familiar with this diagram of becoming an anti-racist, right? But we said we certainly don't want to be in that fear zone. We want to be in this learning and growth zone, because that's how we truly develop our workforce into being anti-racist and having this anti-racist culture as well as overall organization. Next slide, please. So we determined there are 9. For our organization, there are 9 domains. We determined that explicit anti-racist domain was needed to, ensure the deliberate and meaningful anti-racist training and development for staff. Next slide. So the overarching racial justice competencies that we wound up, sorry, I do have dogs, 1 second.
Kiki, you're still on mute.
Sorry, I was just trying to get him to stop.
Okay.
And he's still going. But so the overarching racial justice competencies from our gap analysis that we had used with staff were these 3. So we said after the staff prioritized all of the 8 main core competencies, we also decided that there were 3 overarching racial justice competencies that would be applied across the organization. So this means that each of the job categories have these racial justice competencies integrated into their job descriptions as well. So it says, give us a moment to read the slide. Right, so these are, they're labeled here. So we wound up moving, I'm so sorry, moving the racial justice competencies. There's 151 overall. We prioritize some of those down from our leadership team to about, I think, 25. And from those 25, we had staff prioritize which ones absolutely do you need. And these were the 3 that came out on top. So these are overarching, or another word for that is cross-cutting racial justice competencies. Next slide. So these are some of the things that we're doing in creating an anti-racist workforce. So part of this process has been development of our education and engagement placement program. And this is this whole process, really, we would normally call this, right, like student placements or, right, part of our academic health department. But we wanted to make sure that it was more equitable and to ensure a more diverse and representative workforce and eliminate more biases. So we have different types of placements that encompass all different types of learners from all different walks of life at all stages of life. So there's non-academic, which is like your traditional non-academic kind of like more job readiness placement that is not for academic credit. Certainly, we do have many academic partners. We have around 9 active ones that we work with pretty regularly in Milwaukee. But then we have what we call reverse placements, where we go to the classroom and have some of our subject matter experts go sometimes just depending on what the instructors are asking for. So, you know, if it's a maternal child health class, we'll have our BOM doulas go out there, or some from our maternal child health home visiting program, some of our nurses, and then also in that informal mentoring. We're also in current development, very exciting, our anti-racist preceptor training. So there was a previous training that was offered by another entity that was about 2 hours away from Milwaukee. However, if you can see my picture, was ran by 2 women who look like me, which is not very representative of the Milwaukee community overall. And so this overall preceptor training was not really considering those power differentials, microaggressions that we know can result and permeate workforces, right, from how racism, right, is just kind of manifested in the world and then into our workforce. So we said we're going to use these racial justice competencies to develop this anti-racist preceptor training. So we've actually been using a non-academic placement participant in developing those. So it's been a semester-long process so far of combing through anti-racist literature, teaching, mentoring frameworks, and we're in the process of synthesizing all of those and putting those into a preceptor training. So everyone going forward, once this is finalized, will then, if they're going to take a placement, meaning a student or a shadow or an observation, will have to go through this anti-racist preceptor training in order to host that student. Because we want to make sure that people are having a very positive experience when they're interacting with the health department and learning from our staff. We've also been going to the source curriculum. Myself and a couple other people in leadership have presence on not just nursing, but other public health advisory boards to include racism as a determinant of health in curriculum. Right, we always would tell the faculty, right, if these students don't know that addressing racism is their lane, it's because school didn't tell them or didn't drive it home, right? School is their kind of baseline that needs to be kind of planting that seed if they're not familiar with it already. Some students are, but to get everybody aware that this is a very strong driver of how we see health outcomes play out across the lifespan. And so, and then with our explicitness with the racial justice competencies, like I said, those three overarching racial justice competencies touch all job categories, the anti-racist specific trainings and the workforce development plan. So Lindsey mentioned, I think she mentioned one of them, but the trauma-informed care training that we're having, and then there's some other ones that are focused on that. So that's again, all the job categories have those overarching racial justice competencies. And so all of those trainings will apply to all staff as well. And this, again, if we're developing a staff, whether it's in-house or if it's something we're contracting out for, we're using these racial justice competencies in the development of all of our trainings. Has to be a part of everything we do. We can't just say, oh, well, that doesn't really matter. Like we shouldn't, that's just this training, or, something that maybe someone might think is just basic and doesn't need to maybe use the racial justice competencies. Racism affects everything. And so we have to make sure that we are being thorough, and it has to be a part of everything that we do to dismantle racism, especially in our public health workforce. Next slide, please. So some tips to get started. Buy-in from leadership. Lindsey mentioned we're very lucky that we have very supportive and positive I would say support around having an anti-racist workforce. This, we understand, is not able to be done in every single community, especially in some polarized communities. We recommend using a universal benefit and harm approach, depending on how you want to frame that. Right, that addressing racism is a universal benefit, or the opposite way, not addressing it is universal harm. It's always better if you use the positive connotation of that, but however you want to use it to begin that conversation. I do have a couple resources in just showing how racism affects all communities, right? And how that actually affects everyone's health outcomes as well. Minnesota Department of Public Health had a quote that I think is so important. It says, if we're not all healthy together, then none of us are as healthy as we could be. And that's kind of like the highlight behind this idea of how racism is a universal harm to our communities. Communication with staff, like Lindsey mentioned, we do have an anti-racist policy. So this outlines what's expected of staff and what happens if there are issues with racism within the workforce. Also how our work supports anti-racism and beginning those introductory trainings on frameworks, shared language, values. We're doing that across multiple committees but also in the Workforce Development Committee. The public declaration helps kind of set the tone. So that also then kind of creates a platform for accountability. Great to be able to educate the community about universal harm and benefit, because with the community behind us, it makes it that much easier for leadership to have that buy-in. Next slide, please. Anti-racism policy, which I just mentioned, explicitly discusses what is expected of staff and what will happen if racism is encountered in the workplace. Anti-racism questions, so these are included in employment interviews, but as well as placement interviews. So if someone wants to even shadow at the health department for 1 8-hour day, they have to fill out an application that asks about anti-racism and how they see themselves contributing to us becoming an anti-racist organization with their placement being there. And then use communications to help shape narrative. We have this ongoing communication with the public to help shape narrative around anti-racism and promote community around it. So we have a really excellent communications team that weaves these narratives into a lot of the posts and interactions that they have with the community, which is great, right? We want to create this positive, not polarizing narrative about anti-racism. And we know sometimes that can be difficult. So definitely utilize your communications team. Communications are a science. It's a lot more complicated sometimes than people think. So tap into those individuals, because they are really going to know the finesse behind how things should be worded, how things can kind of promote community and connectedness. So yeah. Next slide, please. I think we're all good with that. And questions? If you go to the next slide, that is going to be Lindsey and I's information. Please reach out. You know, with public health, some of us learn from going to trainings and going to school, but most of us learn from each other, right? It's kind of like trial by fire. We all say, yeah, you know, like you learned that in public health school, but you didn't learn X, Y, Z. And so we're more than happy to discuss different strategies that we've used. And I also firmly believe that having that community of practice allows us all to learn from each other. Maybe we learn also some things that we didn't consider. And that's really how we help build all of our communities, I believe. So thank you all.
Thank you so much, Kiki and Lindsey. And let me invite Lindsey and Brenna back on screen for our Q&A. And I saw a few comments in the chat box noting, you know, thumbs up for Sonia and the work that she does. For those of you who are attending the public health improvement training, you'll have an opportunity to see Sonia there in New Orleans. Excuse me. And Kiki, I have to ask, because I suspect others are interested as well, your dog's name and what type of dog?
Oh my goodness. So I'm so sorry, everyone. He's the one that barked is a Shar-Pei Husky Lab. So he's already sassy by nature, but he's older. He has dementia. So he just barks at things. And it's really hard to redirect him sometimes because he's just a little confused. But he's my first baby. So
Oh, thank you.
Yeah.
Excuse me, there were some comments about the vacancy rate, and Lindsey, thank you for responding to that. I know many health departments, they are experiencing vacancy rates, recruitment issues, time lags, retention issues, et cetera. And those of you who may be interested, the Council on Linkages is forming a retention and recruitment learning community. We just had our very first work group meeting to start formulating how that community will operate. And Lindsey, I know you're part of that. Brenna, I can't remember if you were part of the work group as well. Yeah. And so anybody who's interested, maybe somebody on my staff can put in something in the chat box about the retention and recruitment work as well. So there was a question about the model itself. This was a question for our colleagues in Milwaukee. Is the model that you're using and I'm assuming it's talking about the racial justice competencies model. Is that being used just by the health department, or is this citywide?
Great question. It is not being used citywide. The health department in Milwaukee is kind of like we go first, and then we hope to get others participating with us. I'm one of the members of the citywide racial equity team, so like we bring forward the work that we're doing in the health department. But they are not using the racial justice competency model that we have decided that we want to implement. So we're hoping that they'll see the work that we're doing, and then with us being able to share the positive feedback of what we are doing, then we are hoping that we'll bring that change forward, because the mayor has stated that becoming anti-racist and addressing the issues in our community is important. And, you know, with the health department, we've just decided that we're going to show it and do it. So, and it looks like, Jonathan, you asked about so one of the questions Jonathan Fuchs asked related to like, how do we know that we're doing better? Like, how do we survey staff or whatever? So we use PH Wins, but then we also have an annual racial equity survey that we're doing internally that will give us ideas on like inclusion, belonging, also like their comfort with racial equity topics and those sorts of things. So Jonathan, yeah, we can get the survey information to PHF if PHF doesn't mind sending it out to everybody who registered for this.
We'd be happy to do that.
That'd be great. There's a bunch of other amazing questions in here, so I'm just going to mute so other people can talk.
I know I'm just following them along here. This is a question really for all three of you. What were employees' original reactions to all of this work, and how did you get their buy-in? So, Brenna, let me ask you to start off that conversation.
Sure. So, I'll be the first to tell you, I'm not really super sure what their reactions were, because I don't get to see them all face to face. So I probably had some eye rolls, to be honest, but I also do a lot of organizational health work in our department. And so we do a quarterly, it's a statewide organizational health survey, and I'm the face of that for our department. So when I came on to say, hey, we're doing this workforce development plan, and there's another survey, they remember me from that and from the strategic planning all staff survey that we did as well. And so now anytime there's a survey, they think it's me, which is fine. And they reach out and say, hey, is this you? What is this anonymous? What is this? And so I think they just see me as the survey lady. And so when I was explaining the approach to the plan and that their chance to weigh in was now, I said similar to the strategic plan. So I think there was probably eye rolls and like, oh man, another survey, they want something from me. But hopefully selling it with that approach of like, your voice is important and this is your chance to get it in the plan helped. But to be honest, I'm not sure what the reaction was. Our participation was very good, over 600 responses. When that organizational health survey, we normally get between 45 and 50% of the department. So we were happy with the 600. It was significant enough to roll with it for our plan.
And let me ask Lindsey and Kiki to weigh in.
So I have the benefit of having worked in other city departments that are not the health department. So when we first, the city first established the Office of Equity and Inclusion, it's something that each department was responsible for having individuals who participate. And in other departments, it was fought, but in the health department, it feels very much like people were wondering what took us so long to move forward with implementing. And we've had a lot of people sign up to be a part of our workforce development committee. Kiki, do you know what the current number is?
I believe it's 16.
So we have staff from all over the organization who are participating, and we had decent participation in our work groups when we were trying to determine which of the competencies were most appropriate for each of the 6 job categories. But I think that employees are really receptive to it in the Milwaukee Health Department. We've gone through a lot of changes. We're still trying to rebuild our culture to one that's more positive, and we still have some legacies from some of our older experiences that have happened in the past. So I think employees are appreciating the transparency and the involvement that they have in the process. Kiki, did you want to add anything else?
I was gonna agree with you. I think there's been multiple, anecdotally, I've had comments made to me saying that staff just have never been used to having this much involvement and say so and participation in creating, right, this culture that is so supportive. I worked for the health department 2 times before. I've kind of vacillated between them and other communities, other organizations in the community. And this is, you know, by far the most positive, supportive, right, focused on development, focused on being anti-racist, really walking the walk that the health department has ever been. And I think that that's felt by staff. I was going to say another thing, we maybe touched on it, but something that's helping kind of build that culture is one of our ongoing initiatives from our racial equity initiative of caring conversations. So it's a time when staff, again, across the department, across job categories, come together and we talk things racial equity. We talk about challenges. We talk about, we're having one tomorrow and it's on microaggressions. So people have really found those extremely helpful. Again, lots of staff saying, I didn't even realize that this was racist or that this policy affected, you know, this group of people more than another. So it's really causing some great self-reflection and at the same time creating that positive culture around staff development and becoming an anti-racist organization.
There was a question about training that's provided, additional training your organizations may provide. And then I'll combine that with another question that's for training that's not mandatory. How do you get people to attend? Their categorical grant programs may not allow them to attend. Like, how do you make that happen? Maybe Brenna, we'll start with you on that one.
Sure. So it's an interesting question, and I think behind the scenes, it would depend on the grant and the program and the team in particular. So I think any department sponsored training is across the board allowable for anyone to attend. And they would code their time within our timekeeping system to the most appropriate funding source. But then when it comes to any like additional things, like external things, we have a lot of statewide learning opportunities as well. Those normally are just automatically approved, but we would probably just go through your first supervisor approval. And from the director's office level, we will assume if you have registered that you are approved to attend. So we probably are not going to build in any checks like that just because that would be all we do all day. So that's kind of the approach I think we're going to be taking.
And Lindsey, Kiki, any thoughts about that?
We similarly, like we have employees code, we have like a general account code for them to note it in payroll. But we really are prioritizing employee development. And so we will say like, this is voluntary, but we still have employees that are participating because they're craving the development opportunities. And we also, like, I usually will push out the messages and I'll start with our deputies. And then for whatever reason, people actually read HR's emails, which is great. So we get the deputies on board and then the directors and the managers, like right after this, I have a directors meeting. So we usually push it to them and then we have them encouraging it and making space for the employees to be able to attend. Some of our programs that it's harder for them to attend, we try to schedule trainings, like our WIC program is very they have scheduled appointments and they have walk-ins, and so we'll try to make sure that we schedule trainings that will be convenient for them, or like our sexual reproductive health clinic, they can't stop providing services. So we'll figure out ways in which individuals can participate, and we'll try to meet it where they're at so that they can be a part of that.
Okay, Kiki, anything else you wanted to add to that?
Yeah, I mean, I think Lindsay covered everything
Okay.
on that one. I would just say, I think what she mentioned about, talking to directors and the deputies, they've been really good about, just kind of setting the stage and setting the culture around continuous development and improvement, which again, I think, right, helps staff kind of naturally move into that space, right? They, like Lindsay said, they want to learn, they want that development. So yeah, I agree.
Great. And I see a question in here about equity addressed in, are there other areas for equity addressed in the plans? And I'm assuming this might actually apply to both Milwaukee and Missouri. That Janice Johnson is with the rural community and just asking about areas like elderly, rural, ag, immigrant, and other language populations, etc. Anybody want to? I see Brenna, you're nodding, so maybe we'll go start with you again.
Sure. So, Janice, we also are a very rural state, of course. We kind of have the whole gamut, but for the workforce development plan, we really focused on our internal workforce. So the equity areas to address community equity concerns are more like our state health assessment, state health improvement plan, our strategic plan. Those other ones, all public. If you're interested, I can drop a link to the chat to one of our public sites that has all of our plans on it. But that would be more what we would address there. One of the assessments within our workforce development plan was a racial equity and inclusion belonging kind of assessment that we actually removed from the plan that's published on the PHF website, just because of the kind of environment in the state of Missouri around those topics. They're included in our assessments and our plans and our priorities moving forward, but when it comes to publishing things, we are a little more careful about it. But I would just say other plans are where we are addressing the equity of the communities.
Lindsay or Kiki?
So this is a big question. Well, we have our community health improvement plan that we work with the community on. We also are facing some future planning for newly arrived individuals. So individuals who are potentially bused or flown up to us from Texas or Florida. So we're planning for those things. I'm trying to go back to what the question was.
Oh, gosh, this was about, well, you don't really have rural communities, but you have.
Yeah. Not so much, I mean, Milwaukee is populated, but there are a lot of rural areas in
And
Wisconsin.
you have immigrant populations within.
We do.
Milwaukee area. So really it's special, the equity issues, or does plan address different populations?
So we do have, we are working towards language justice for populations. We do have ways that we can get translation services, but we're also looking to support and certify staff who are interested or able to be able to do translations for different languages. And then we do have community groups that we work with that serve the populations, the newly arrived populations that are coming in. Most of our WIC program and our health access programs, we work with a lot of individuals who are new to the US as well, to ensure that they get health care and proper food access.
I think I'll go to this one last question before we wrap up. And this is for everybody as well. Are you sending your public health workers to more of a general foundations of public health, fundamentals of public health training for those who may not have a public health background, those who may have been in the field even for a while and public health has changed a bit? So any thoughts about that? You know, Brenna, Lindsey, Kiki?
Sure, I can kick us off again. So we do include a Public Health 101 in our new team member orientation. We do 2 sessions on that, the first day and then 90 days in. And so for the first day, it's like, hey, how to get access to the buildings, where are the restrooms, that kind of stuff. 90 days in, we come and do Public Health 101, and I do strategic planning and department planning kind of overviews. And so that is a big one where we cover the foundational public health services model. For existing team members that maybe haven't been through new team member orientation in the last few years, we are looking at connecting with our state. It's called the Healthier Mo Initiative. They're a grassroots initiative that created a state-specific FPHS model that we've adopted. They offer training, so we are going to be probably connecting with them to create a custom training and loading it into our statewide learning management system to push out to everyone. So that is one of the goals within our plan, that we get an FPHS at least training out there, so everybody knows we have a foundation of people that understand the foundation.
Great. And Lindsey and Kiki?
So for Milwaukee, we're still trying to formalize it, but when new hires start, we have them register for both Train Wisconsin and the Region 5 Public Health Training Center. And there's a Public Health 101 that we recommend that individuals take so that they get that foundation, especially if they're not from within public health. But our goal is to make sure that we have our required annual trainings and then refreshers actually built out in a calendar. So it's something we're still working on for 2025. But we do try to tap into trainings that already exist for those things, so that individuals can get that knowledge.
And Kiki, I see you've come off mute.
Yeah, I was just gonna say, and I would just add, we also, it doesn't run regularly, so sometimes it doesn't always align with when people are starting, but we do send our employees to the New to Public Health residency program through UW-Madison Population Health Institute. Sorry, that's a long name. And so again, they go in cohorts, but it's really great. It is multidisciplinary. So it doesn't matter what their background is. Our actual, I think, percentage of people with public health, either bachelor's or master's degree, is relatively low. It's around, I think, 20%. So the majority of people, right, are coming in with a background other than public health, or education and training other than public health. But we all know here on this call that public health is everything, and everything is public health. So it's just really kind of helping them see it from that lens, that everything contributes to maintaining the public's health. And so, like Lindsey said, our intro trainings, the Public Health 101 modules that we use online are great, and we're still working on it. But the New to Public Health residency, if you all aren't familiar with it, it's very, very helpful. Get a little bit of camaraderie. There's some didactic portion, but also some networking portions, so they can build a little bit of a community. So definitely recommend looking into that.
Great. Thank you again. And thank you, all 3 of you. I do want to say that the 3 of you are passionate leaders working in this incredibly important, enjoyable, and sometimes frustrating area. And thank you so much for sharing all of the wonderful work that you're doing. If you are interested in learning more about the Public Health Foundation's Performance Improvement Consulting Services, you can go to that QR code on the screen, or you can contact me directly at rbialek@phf.org. And technical assistance we provide and training we provide can be requested by public health infrastructure grant recipients through the 5 system, or you can contact us and talk through with us a fee-for-service arrangement as well. And last but not least are some additional resources that may be of use for you. One of them is the public health capacity gap analysis work that we've been doing and helping organizations prioritize when they have many gaps, what gaps to fill first. Core competency tools. I know Kathleen, you put that information in the chat box. Thank you for doing that. Somebody asked about general public health training, introductory foundational training. The Train Learning Network has a lot of free training in it in that area. More than 5,000 trainings. We have more than 5 million users of Train, and we'll be sure to send information out about that when we send the archive webinar as well. And for those of you who may be interested in staying in touch and being updated with new resources that we have and new tools and events that we have an e-news, Public Health Foundation e-news that goes out once a month. We do not spam folks, and we are diligent in not sending out too many emails with that. So finally, again, let me thank you, Brenna and Lindsey and Kiki, for all you do and for the sharing that you've done today. And thank you all for participating with us today on this webinar. And with that, we'll send you all back to the next thing on your agenda. Thank you again.